My name is Stephanie Hines, and this is me setting up an IV drip. What we're going to do is get the medication. We're going to start with the 7 steps, check the physician's orders, wash your hands, gather equipment. That's what we're going to be doing here. And then we will go to the patient's room. We will be identifying the patient, introducing ourselves, explaining the procedure, and providing for privacy. So what we're going to do is we're going to get the medication. Since we're administering medication, we have to make sure there's the 7 rights are correct. Right time, right patient, right drug, right dose, right route, right reason, and their right to refuse. We're always going to make sure to document everything. So that's when we add the medication sticker, make sure to fill it out if need be and place it on the opposite side. Always double check that it is not expired. What we're going to do is get a sterile tubing set, open this up, and the needle in order to spike the bag. Make sure the clamp is closed first off. Then, keeping everything sterile, we're going to take the cap off the end, open the clamp. We're going to fill this to the fill line. And once we open the clamp, we can start to regulate the drip factor, which is going to be 60 drips per minute.
60 drips per minute. And I'm going to have my punch ready. Close to the chamber.
So we check for 15 seconds.
I would slowly
Make sure.
unroll the clamp. So it'd be 15 drops for 15 seconds for 60 drops per minute.
Okay, once the drip factor is set, we're going to clamp this off and bring it to the patient's room. Once we bring it to the patient's room, close this, keeping everything sterile on the way. We're going to take a sterile alcohol pad, clean off the port here, and clean off their port also. Always, first of all, make sure that their site is not inflamed or red. I would be having gloves on at this point. Connect the tubing and open the clamp, and then the drip is set. If need be, we would be adding a medication. Well, first off, we'd put this on the tubing, the date, and who put on the new tubing.
Yeah, you did. I know I did so.
And then if we need to add medication, what we would do is, again, make sure it's the right medication, all the 7 rights, and put on the sticker, fill out the sticker, and put it on the back side so they can still read the front. Then we're going to move this one down. Put a sterile tubing set. Make sure the clamp is closed. Open the needle and open the bag. Spike the bag. Hang it up. We're going to get all the air out of here and prep it. Fill to the fill line. And set the drop factor again. And clamp it off. We are going to sterilize with a new sterile pad the port that we're going to be putting it in, the upper port, and make sure that we connect these two. Open this back up. And we can regulate it if need be with the main port. And that's how we would do it. If after the medication is finished, we would wash our hands, and then to disconnect it, we want to close this one off all the way, take it off of the port, and then remove the medication. And last, we would put this back up to regular height. that's IV drip.